Welcome to Dr. Samimpedia YouTube channel. Today I am going to discuss about the fetal laceration injury during delivery and its prognosis and management. Fetal lacerations are cuts that occur during delivery. Most often, lacerations during C-section deliveries, as doctors use scalpels and other sharp instruments to deliver the infant. Most of these injuries occur to the ears, face, and head. Here I am repairing a lacerated scalp injury with suturing, as it is a deeper lacerated injury, but minor injuries may not need suturing. There are several risk factors that increase the chances for fetal lacerations occurring during a C-section delivery. The principal risk factors include ruptured membranes before the C-section, low transverse uterine incisions, active labor, emergency C-section, inexperienced surgeons or residents needing to cut through the placenta to get to the baby, and lastly, undeveloped lower uterine segment, a uterus that has not labored. Generally, the prognosis for fetal lacerations is favorable. With timely treatment and monitoring for possible infections or complications, most infants recover without incident. Infants who develop facial nerve palsy or have more severe injuries may require a longer treatment program or reconstructive surgery, but still, the prognosis is generally positive. There is ongoing research looking for possible ways to prevent fetal lacerations. Although research continues, a device called C-Safe has proven to be an effective method. The C-Safe is a small surgical tool that offers added protection during the C-section process by allowing physicians to cut upwards and away from the infant. Other prevention strategies include moving the uterine wall prior to incision, elevating the presenting part, pushing it away from the incision manually by pushing on the outer uterine wall, overlying the head, buttocks if the baby is breech. Thank you for watching.